Today we're here to discuss about Zimbabwe's health issue. My name is Mary and I'm here with Crystal, Raymond, and Kevin. The top burden of disease in Zimbabwe is HIV and AIDS. Lower respiratory disease comes in second. Due to polluted water, diarrheal disease comes in third. Neonatal condition like preterm birth complication, birth asphyxia, and birth trauma comes in fourth. Nutritional deficiencies such as protein, energy, malnutrition comes in fifth. Unintentional injury is affiliated with road injury comes in second last. And the last burden of disease in Zimbabwe is interpersonal violence where injuries are made intentionally. The top causes of death in Zimbabwe for all ages is HIV and AIDS. The second cause of death is lower respiratory infection caused by the mining industry and the bad air pollution. The third cause of death is road injuries, and the last top cause of death is stroke.
The highest burden of disease we found in Zimbabwe is HIV and AIDS. Zimbabwe has a record of having the highest amount of death in 2015 due to HIV and AIDS. Through our research, there are two relevant risk factors contributing to this problem. First is the lack of education on drugs and sex. The second factor is unprotected sex. As many citizens of Zimbabwe are unemployed, they rely on engaging in sex activities to make a living for themselves and their family. However, sex activities are considered illegal in Zimbabwe, so they tend to avoid using condoms to get rid of evidence, which increases the risk of HIV and AIDS. Although the sex activity provides income, it also brings them stress and guilt, so they tend to use drugs and alcohol to overcome it. Other than that, it is reported that many children in school are addicted to cannabis.
Other than the problem of HIV and AIDS in Zimbabwe, lower respiratory infection can also pose a big threat to the people of Zimbabwe. In 2015, there were over 11,000 deaths caused by lower respiratory infection, and through our research, we have found the risk factors contributing to the problem to be automobile pollution, indoor pollution such as wood burning, and tobacco use.
Diarrheal diseases should be one of our key focuses moving forward. This disease is easily prevented under the right circumstances. The DALY value right now is at 510,000. This is the third highest DALY value in Zimbabwe. So to protect people with weak immune systems, such as children or individuals with HIV, Zimbabwe must improve the country's overall hygiene and minimize needless mortalities. So this would include sewage, industry, and garbage pollution.
Since many citizens of Zimbabwe do not realize the severity of HIV and AIDS, we hope to correct that by targeting the younger generation. Mandatory testing in schools can reveal kids at risk, but it will also spread awareness throughout their communities. Routine testing will commence upon entering the education system and annually after the initial testing in order to reduce risk. We hope that by creating a testing routine, citizens will destigmatize HIV and AIDS. Patients and adults will also be participating in tests.
Other than conducting mandatory testing, we also recommend integrating sex and drug education into the school system by educating the causes and effects of HIV and AIDS, identifying the symptoms, and lastly, how to prevent and protect themselves. We hope this integration can allow students to discuss this issue openly and comfortably. Also, the country can host an annual community event, such as a football game, to unite and eliminate the barriers among society and capture the attentions on HIV and AIDS.
In order to solve the problem of lower respiratory infection, the government must demonstrate a persistent approach in improving the citizens' safety. By collaborating with the mining industry, and the government will ensure safety procedures and equipment are in place at all times. There will be zero tolerance for any violation. Mine workers will also be tested annually to check for any respiratory issues. We will also be checking the factory's pollution output to ensure a safety standard.
To fix Zimbabwe's sanitary issues, we need to update the waste system. Not only do we need to be able to handle more garbage, we need to be able to reduce the amount of garbage being created. We will do this by separating the garbage into three categories: garbage, organics, and recycling. We will teach the system and its benefits through pamphlets and radio broadcasts. Individuals will be able to dispose of their garbage at predetermined pickup locations.
If Zimbabwe follows these recommendations, we hope to see noticeable results after 12 months. Thank you for listening.